What I would first just touch on is the importance of what Tom was talking, the idea of independent physicians or medical practices that are taking care of you, especially in primary care, because there is a mistaken idea that doctors and hospitals are on the same team. And honestly, if I'm owned by a hospital in the care that I'm giving, I am motivated and even financially incentivized, and certainly, the hospital wants me as part of their team, not because they want me to keep people healthy. I mean, that's the bottom line, is they want me to be a feeder, even a loss leader if necessary, somebody who can feed their hospital system. And if I'm feeding the hospital system with people in the hospital, people going to the emergency room, people utilizing specialists, to some extent, as a primary care doctor, I'm failing at my job. I'm not preventing those diseases. I'm not handling them well. And the worse job I do as a clinician, the more money the hospital makes, which is why you need independent primary care. I see my job as playing defense against the hospital system. And so it's really, really important to maintain that independence.
Yeah, and I'm going to jump on top of that and dive a little bit deeper into what's happening in our market, right? So across the country, when we look at independent providers versus hospital-owned providers, right? So outside of our market, the national average is 74% of physicians are now owned by a hospital system, right? So to Rob's point, they're incentivized to drive procedures through the hospital system. Let's get those procedures done at the highest cost of care, which is the hospital themselves, right? But in our market here, we are basically reverse, right? We are 74% independently owned today. So we're in a market where we as employers and independently owned physicians have an opportunity to really create something different, to really control where procedures are done, ultimately controlling the costs and being better consumers, right? So, what has happened over the last year and a half, Piedmont has come into our market and taken over University Hospital. Okay, our cost of care in our market, everything is based off of Medicare being the baseline 1.0, the cost of claims 1.0, Medicare is our baseline. University Hospital, and our average in our market was about 2 times Medicare, which is extremely low across the country in reality. With Piedmont coming into our market, they're going to bring their pricing. They're an 18 hospital system, mostly in metropolitan areas, which the cost of living and the cost of care is a lot higher. So I'd say 3 to 4 times Medicare is where they sit. We're just now recently heard that Wellstar is now in process of potentially entering our market, right? They're doing their due diligence, and with that comes higher pricing as well. So what does that all mean? That means that doctors that are aligned with those hospital systems are now going to drive up the cost through that system, and ultimately claims will cost more because the claims reimbursement from Medicare is higher in those metropolitan areas. And if their pricing is coming here, we're going to go from 2 times Medicare to 4 times Medicare. So let's just say a knee surgery that was $10,000 is now going to cost $20,000, $30,000, $40,000. And ultimately the employers through their premiums are paying those costs.
And I would emphasize that increase in cost does not mean that the physicians are making any more. In fact, typically in those types of hospital systems, those physicians will make less or at least stay even. So all of that extra cost goes to administrative. It is not into improving care.